Hello everyone, my name is Kim Miller and I am a lead profitability coach with Inspired Hygiene. And today I want to talk to you about loving your patients. Now I know that you love your patients, and one of the ways that you can show them how much you love them is to make sure that you are being prepared for April. April is Oral Cancer Awareness Month. Now, just to remind you, oral cancer is continuing to be on the rise. In fact, cases have gone up over the last few years from 25,000 cases diagnosed per year in 2011 to 51,000 cases diagnosed as the years have progressed. So in 2018, 2019, it's almost doubled. One of the things I want you to remember is that when oral cancers are diagnosed, they are typically discovered and diagnosed in stage 3 or stage 4. Well, here's the problem with that, is that most of those patients who receive that diagnosis in those late stages of cancer are going to die within 5 years as a result of that aggressive cancer. The other thing to remember is that HPV is intimately related with many of the oral cancers, and it's in the back of the throat, not necessarily in the vestibule area. It's very important that when you're doing an intraoral cancer exam for your patients that you're using some type of diagnostic light. One of my favorites is the Oral ID light. Of course, Velscope is out there. There are many different options of lights that you can use, but those are going to illuminate the inside of the mouth and use illumination and transillumination to allow you to better identify abnormal looking tissue or abnormal looking cells. And with HPV, the other thing to remember is that as we age, HPV often shows up in the 5th, 6th, 7th decade of life. So your patients that are in their 50s, 60s, 70s and on up really need to be screened regularly. And that's getting a really good look at the back of the throat, having your patient open their mouth very wide, saying ah, pulling their tongue out so you can really get a good look at the back of the throat. There really is an ongoing lack of public awareness when it comes to oral cancer. And keep in mind again, April is coming. Get prepared. You can contact the Oral Cancer Foundation. There's lots of resources available to you. And again, why do we do this? Because we love our patients and we want to take great care of them. So show your patients the love. Be prepared for Oral Cancer Awareness Month. Create a community outreach. Go to oralcancercause.org and you can order some supplies. They'll even send you some things for free to help you get started.